So when we think about work-family policies in the United States, we usually picture families that look like this. It's quite obvious that the arrival of a new child brings new demands on parents' time. And for working parents, that means figuring out how to navigate the demands of their work with their new responsibilities of caring for their child. But what I'm going to argue is that the challenge of managing work and family doesn't begin when the child is born, but actually before that, during the pregnancy period. So work-family policies are also needed for families that look like this. The prenatal period is the most rapid period of brain development. What happens between conception and the birth of a child lays the foundation of brain architecture. And there's a wealth of research that this has lifelong consequences for children's future health and development. It's a period when a child is most susceptible to its environment, most vulnerable to harm, but also most receptive to positive influences. So things like adequate nutrition and quality health care promote maternal and infant health during pregnancy, whereas things like chronic stress and lack of economic resources cause harm. Now, because of this heightened susceptibility, what this means is that investing in women and children during this period has the potential to reap the greatest benefits. Anything we can do to increase protective factors and minimize negative influences during pregnancy is going to pay off in the long run. And it's not just children that undergo rapid change during pregnancy. Women do too. There's obvious physical changes, but they're also at increased risk for various health conditions. There are things from morning sickness to exhaustion to more serious things like gestational hypertension and diabetes. At the same time, there's harmless activities that wouldn't normally pose risks to mothers and children that during pregnancy have the potential to cause harm. So for example, we know that drinking alcohol during pregnancy can be harmful, but also things like prolonged standing, lifting heavy objects, those things also pose health risks to women and children. So as a result of all of these changes, women have to make changes to their daily lives. And this also includes making changes in their job. Most pregnant women in the United States work during their pregnancy, but employment declines throughout their pregnancy. So what I'm showing you in this figure is that at the start of pregnancy, the percentage of women who are working in each month before the birth of the child up through 12 months after the birth of their child. So what you can see is that while 74% of women work at the start of their pregnancy, only 55% do so in the month before their child is born. So why might this be? Are women voluntarily leaving the workforce, or might they be pushed out of the workforce? Well, when we look at the same figure, but we disaggregate these trends by mother's education, we see really stark differences between women who have a college degree and those who do not. So women with a bachelor's degree maintain relatively high levels of employment throughout most of their pregnancy. Their employment declines by 14 percentage points. But among women without a college degree, they begin to leave work earlier in their pregnancy, and their employment declines by a larger margin, by 22 percentage points. Research shows that women's earnings are key to household income during pregnancy. As women's earnings decline during pregnancy, so does their total family income and their income adequacy. This decline in income adequacy is even more pronounced for women without a college education, putting them at an increased risk of poverty. So this suggests that these women are not better off by not working, and instead they might be not be leaving the workforce voluntarily. Instead, what this suggests is that women without a college education are overrepresented in low-wage and low-quality jobs that are often unsupportive of pregnancy. So let me tell you about Lexi. Lexi is a 25-year-old woman who works at a large chain retailer in the stockroom and restocking shelves. When she finds out she's pregnant with her first child, she is excited but nervous, and her partner and her have been on and off, and so she's not sure if she can count on him to support her during the pregnancy and after the child's birth. But she's grateful to have a job that has health insurance and that provides her some level of financial security. At her first prenatal appointment, she tells her doctor that in her job she regularly lifts heavy objects and is on her feet most of her 8-hour shift. Her doctor informs her that this repetitive lifting and standing could pose risks to her and her child's health. So she gives her a note so she can request a transfer to a light duty position from her employer. Now, if Lexi had made this request just 1 year ago today, her employer would not have been obligated to grant this request. But on June 27th of 2023, the Federal Pregnant Workers Fairness Act took effect. So under this law, pregnant workers who work for employers with at least 15 employees have the right to reasonable accommodations as long as it does not cause undue hardship to their employer. These accommodations have to be granted due to pregnancy, as well as in the postpartum period due to childbirth and breastfeeding. These accommodations include things like light duty, more frequent breaks or longer breaks, schedule flexibility to attend prenatal appointments, and unpaid time off to accommodate medical conditions that might arise due to pregnancy. Now, before the Pregnant Workers Fairness Act took effect in 2023, many states already had a pregnancy accommodation law. Between 1990 and 2019, 30 states in Washington, D.C. passed a law that was similar to the Pregnant Workers Fairness Act. So in our research, we wanted to know what were the effects of these laws and were they helping women remain employed during pregnancy? What we found is that state pregnancy accommodation laws do indeed help women work during pregnancy. This figure from our study shows that women's employment increased in states with a pregnancy accommodation law after the law took effect. This is compared to states without such laws. So on average, pregnancy accommodation laws increased women's employment by 6.6 percentage points, or about 11%. We also found effects on labor force participation, on earnings, and the number of weeks worked in a given month. So overall, what our findings suggest is that access to workplace accommodations via these state pregnancy accommodation laws help women to work and work longer into their pregnancy. These findings suggest that the federal Pregnant Workers Fairness Act is also likely to help women remain employed during pregnancy in states that did not already have such a law. So access to workplace accommodations is vital to allowing women to continue working during pregnancy. For Lexi, this meant that she could get transferred to a cashier position that allowed her to continue working for her employer, but without lifting heavy objects and without being on her feet all day. But Lexi's story doesn't end there. Her cashier position is supposed to be 35 hours per week, like her prior role. But sometimes she shows up to schedule shift and she's told to go home early. Now her hours vary from week to week, and she frequently does not work the full 35 hours. So she's having to tap into the little that she was saving for after her child's birth to make ends meet. Like Lexi, about 37% of low-wage workers experience unpredictable work schedules. As you can see in this figure, higher wage workers are less likely to experience such schedules, but 21% of them still do so. And research shows that working unstable and unpredictable schedules is associated with higher levels of stress and economic hardship among workers, and the pregnancy period is a time when maternal infant health is particularly vulnerable to these stressors. So there's no federal law that grants workers a right to stable and predictable work schedules, but several states and localities have begun to pass such laws. Let me take you back to Lexi. So what happens next? So then Lexi learns that she's at high risk for a serious pregnancy complication. Her prenatal appointments become more frequent. Instead of going in monthly to see her doctor, she goes in every other week. Although the Pregnant Workers Fairness Act entitles her to unpaid time off to attend these appointments, she doesn't have any paid sick leave via her employer, and she often has no choice but to schedule an appointment during one of her shifts. This results in Lexi taking a pay cut, and this decline in earnings further adds to her economic stress. As there's no federal law that mandates employers to provide paid sick leave, the lack of paid sick leave is not uncommon among low-wage workers. What you can see in this figure is that while 95% of higher-wage workers have paid sick leave via their employer, only 58% of low-wage workers do so. Research shows that access to paid sick leave increases women's employment and earnings, increases healthcare utilization, and improves health outcomes. And pregnancy is a period where women have to make frequent visits to the doctor and are more likely to experience medical conditions that require them to take some unpaid time off. So this is a time when women would really benefit from having intermittent paid time off to take care of their health and that of their child's. There's one more chapter in Lexi's stories. Towards the end of her second trimester, she learns that she indeed has developed a pregnancy complication that requires bed rest, and her doctor advises her to stop working altogether. Now, she does have access to unpaid leave via the Family and Medical Leave Act, but her employer doesn't give her any paid family or medical leave. So while she can keep her job, she loses her main source of income. This is devastating to Lexi and very stressful. She can no longer make her health insurance premiums and loses her health insurance. Now she becomes eligible for Medicaid, but her provider doesn't accept Medicaid. So this means she has to switch to a new doctor, causing her significant stress given her high-risk pregnancy. She's also able to receive food assistance through the Supplemental Nutrition Assistance Program and Women, Infants, and Children's Program. Now, while these programs are really helpful, they don't provide her with any cash income. So she has to borrow money from family and friends and from her partner to pay rent and bills, and she is finding really difficult to make ends meet. I'm starting to sound like a broken record, but again, there is no federal law that grants the right to paid family or paid medical leave in the United States. This means that only 14% of low-wage workers have access to any paid family leave, and still only 41% of higher-wage workers do so. Now, if Lexi lived in one of the 10 states with an active paid family and medical leave program, she could take leave for her pregnancy-related medical condition. But in about half of the states with paid family medical leave, the total amount of leave is capped to 12 to 18 weeks in a given year. So this means that any leave that she would use during her pregnancy would take away to the leave available to her after the birth of her child. Whereas paid family leave policies grant the right to paid leave following childbirth for all new parents, there are no similar programs that grant the right to paid leave for pregnant women to prepare for childbirth. Now, besides paid family leave, there are other income support programs for families with children, but these are often not available to first-time parents who don't have and currently have any children of their own. So for example, the Temporary Assistance for Needy Families program provides low-income families with cash assistance. But in most states, families are not eligible until after they have children. So for first-time parents like Lexi, they would not be able to get any benefits. Now, without comprehensive work-family policies at the federal level, pregnant women's access to work-family supports depends on what city and state they live in and what their employer is willing to provide. This creates massive inequalities in who receives benefits and supports. And these disparities in work-family supports matter because they perpetuate inequality in maternal and infant health outcomes and really make it critical for policy intervention. So what might an apology package look like in the United States if it acknowledged that the challenge of combining work and family doesn't begin in the post-birth period, but really starts during the pregnancy period? The Pregnant Workers Fairness Act is a step in the right direction. It fills a critical gap in helping pregnant women stay employed during pregnancy and has called attention to the need for workplace supports during this period. But this law cannot do it all. Income supports for families typically don't start after the birth of the child, leaving a large gap during the pregnancy period. We also need policies that allow pregnant women a reprieve from work when they need time off during pregnancy without having to compromise their economic well-being. So let's think about extending income supports, like the Temporary Assistance for Needy Families program, like the Child Tax Credit, to cover the pregnancy period. Let's think about implementing not just paid family leave at the federal level, but also paid antenatal leave to cover the pregnancy period without reducing women's postnatal leave. And let's think about new national policies like paid sick leave and fair work schedules that benefit all workers, but would especially help protect the health of women and their unborn children during a really critical period of time. Now, these investments that we make in the prenatal period will not only help pregnant women in the short run to remain employed and to improve their economic well-being, but they will have long-lasting benefits for children's health and development. So when we think about work-family policies, let's think about supporting families during pregnancy as well, so that all of these parents can support their families economically without having to compromise their family's health and well-being. Thank you.